Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Hey everyone, welcome back to Friends with Fertility. Today we have Lisa Hendrickson-Jack. She is a certified fertility awareness educator and holistic reproductive health practitioner who trains women's health practitioners to use their menstrual cycle as a vital sign in their practices. She is the founder of the Fertility Awareness Mastery Mentorship Program. She is the author of 3 best-selling books, The Fifth Vital Sign, the Fertility Awareness Mastery Charting Workbook, and her most recent, Real Food for Fertility, which she has co-authored with Lily Nichols. Lisa works tirelessly to debunk the myth that regular ovulation is only important when you want children by recognizing the menstrual cycle as a vital sign. Drawing heavily from the current scientific literature, Lisa presents an evidence-based approach to help women connect to their fifth vital sign by uncovering the connection between the menstrual cycle, fertility, and overall health. With over 4 million downloads, her podcast, Fertility Friday, is the #1 source for information about fertility awareness and menstrual cycle health. So that is a lot, and I'm so excited to have you here. Welcome, Lisa.
Thank you for having me.
I know in my course for the Fertility Coach Academy, we reference the fifth vital sign quite often. So I'm really excited to have you here to talk a little bit about that. So for anyone who's listening, what is the fifth vital sign? What is a vital sign, I guess, to start? And then why would we consider the menstrual cycle that?
Yeah, I mean, a vital sign is just a way that we measure how the body is doing. And if we think about the common vital signs like your heart rate or your blood pressure or your respiratory rate, I mean, if your doctor is measuring those things, not only does it give a sense of, in general, if you're doing okay, but if the blood pressure was way too high, there's also a short list of reasons why that could be. So it also provides some more specific information. So when we look at the menstrual cycle as a vital sign, what's interesting about it is sometimes when I say the menstrual cycle, people would think just the period. But if we break the cycle even into its different phases, we have the period, we have the pre-ovulatory phase leading up to ovulation. You know, ovulation is important. And then we have the second half of the cycle. And we could be looking at menstruation, the quality of it. We could be looking at the presence of cervical fluid compared to what's healthy. We should be making it for a few days before ovulation. If a woman has some sort of discharge every single day, even that can provide information. If her period is stopped altogether, if her cycles are too long. So even within just the different parameters that I mentioned, again, not only is it giving general information, but also potentially a roadmap to what could be going on. And I think the reason why so many women gravitate to this message is because we haven't grown up with this message. And even if you think about the use of hormonal contraceptives to suppress the cycle, we're typically kind of sold this idea that our cycles, our periods, it only really matters when we're trying to have children. But if you're not actively trying to have children, it isn't really important. But what you find is that we can't really disconnect those two things. You know, and one example is if we look at the side effect profile for hormonal contraceptive. If it only made a difference for reproduction, then we wouldn't have women feeling anxious and depressed and having nutrient deficiencies when their cycle is shut down, right? So you kind of have to wonder, well, what's going on? And what's going on is that our cycle is actually an integral part of our bodies. And if you are a woman of reproductive age, it is always reflecting back to you the state of your health.
Which again is so infuriating why so many doctors in our country, and I don't know about in your country in Canada, choose to put women on the birth control pill for so many reasons, you know, even down to acne or something, you know, because.
One, I think that in their defense, not that I'm trying to defend them, but in their defense, that's how they're taught. You know, that's what the medical system is. After interviewing many doctors, many MDs on my podcast and asking about, well, what were you taught about the pill? And, why is it that doctors, this is the default response? That's what they're taught. There's a reason why it is the default response. Any type of issue of the menstrual cycle any issues, not even, like you said, acne, like not even of the menstrual cycle, anything with hormones, it's just the pill to pill. And that's how they're taught. So we just have to understand that the medical system was not designed to look at underlying health issues. It was really designed just to kind of suppress symptoms, give you this, take this thing and get out of my office type of situation.
I will say, though, for those that are coming out now, we know better now, so we can do better. And so for anybody who is an MD listening, please, do us all a favor for those women that are coming out.
Well, yeah, that's a good point. I don't want to make it seem so negative, but I'm definitely at the point where, we have to recognize the limitations. And a lot of MDs now are stepping up and are integrating functional medicine into their practices. But I still think that the MDs that are doing that, they are the ones that are hungry for more. They're the ones that are noticing that the limitations in what they learned, the fact that many of their patients are maybe stabilized, but not necessarily getting better. And they are the ones that are taking it upon themselves to seek additional education beyond what their kind of foundational medical degree provided.
100%. I agree. So if you're out looking for an OB or fertility doctor, find somebody who is kind of going beyond their traditional education and digging into some of these things, because the information is there. And I understand that they aren't taught that, but let's start to make a change. And part of that is education like this. So what does a normal, healthy menstrual cycle look like? Because I think, again, we're very misguided by what we are taught.
Mm-hmm. Well, I think, as I mentioned, we often think of it either as just the length of it or just the period. And so I think we can kind of look at the whole picture, what's happening from start to finish. So the first day of your cycle is the first day of your true menstrual bleed. It's not uncommon for women to maybe have some spotting or something like that leading up to it, but it would be the first day that you actually have flow. And so an average healthy menstrual cycle typically falls somewhere between about 24 and 35 days, with an average of about 29 days. And I think that's important just to recognize that if it's not exactly 28 days every single time, you're not a robot. There's healthy fluctuation. And so we would call a cycle irregular if it's fluctuating more than 8 days from cycle to cycle. So for example, if your cycle was 27 days one month and the next month it was like 30 days, and the next month it was like 32, that is actually normal fluctuation. It's not automatically irregular. Irregular would be if it was more like 35 days and then 46 days and fluctuating more than 8 days from cycle to cycle. And then if we kind of break down the cycle a little bit, so I mentioned the menstrual period. So your period, I always say it should have a beginning, a middle, and an end, and then be over, kind of like a sentence. And so what we would expect for a healthy menstrual period, lasting an average of about 4 to 5 days, with an absolute kind of parameter of 3 to 7 days. So it should be long enough, but it shouldn't be too long. And typically starting moderate to heavy. And for anyone who's had periods, you're typically bleeding more heavily during those first couple of days, and then it gradually kind of tapers. And after you kind of exit that active bleeding phase. So one thing about periods, and it's interesting, I don't know if the controversy is still there, but there have been times when I've said that, moderate to severe pain with menstruation, although it's very common, we wouldn't consider it to be optimal. And it's funny because sometimes I say that and I get a lot of pushback. If I say, well, if your pain is so bad that you require medication, we should be considering that to be not optimal. I mean, outside of childbirth, I can't think of any situation where we think of moderate to severe pain to be totally fine. And when we look at, the data and the research, so women who have, moderate to severe pain, they have higher markers of higher inflammatory markers. So one of the studies that I cited in the fifth vital sign, they had the participants that had menstrual pain had upwards of 4 times the level of prostaglandins compared to women without the pain. So there we have a marker showing that these women have higher levels of inflammation. So why are we sitting there calling it totally normal? So common, yes, but not ideal. So a healthy period, I would say, mild pain would be ideal. And I recognize that not everybody has that experience, but if we don't start identifying it as potentially problematic, then how are we going to ever move past this? And then even if we look at the flow, so, what the research tells us is that a healthy flow should be somewhere under 80 mil. So let's say 25 to 80 mil, somewhere in there. And I recognize that, like that's metric. So let's say 1 to 3 ounces roughly. And so the reason for that is women who are bleeding more than 80 milliliters, they're at a greater risk of, iron deficiency and things like that. And it could also be associated with fibroids. The interesting thing about period bleeding is that you only really experience your own and you don't necessarily talk to your girlfriends about it. So a lot of women may have really light or really heavy periods, but they don't have anything to compare it to. So they may not have thought it's a problem. And many women have even asked about it with their practitioners, but kind of not always taken seriously. So that's helpful to know.
In my experience, they just think it's normal, right? Because maybe they have a regular period. I've seen this where it's normal. It's every 6 to 8 weeks and it's, whatever, like that might be what you think is normal, but it's not normal, and the flow as well. So I think, again, thank you for bringing these conversations up, because having those conversations and knowing what that barometer is will help them to understand where they need to start and where they're going in terms of their fertility, assuming that's part of this bigger picture that people are listening for specifically today. So continue on.
Yeah, for sure. And one of the exercises that I've often done in my classes is I'll bring out like a menstrual cup and not blue liquid. Although I feel like now they're starting to use red liquid. It kind of caught me off guard. I was seeing this commercial and I was like, oh, we're here now. But anyway, so I'll demonstrate what that actually looks like. And that is interesting because, again, since most of us have only ever seen our own cycles, it's really interesting. So I find women who bleed on the lighter end will be shocked that there are women who bleed so much, and women who bleed on the heavier end will be like, that's it. So right. It is really useful to have an understanding of what the normal parameters are so that you know where you fall. Because a lot of women, like you said, are just used to bleeding really heavy. Maybe everyone in their family bled really heavy, but they never thought to get an investigation just to make sure that everything was okay. Right. So that's certainly important. So we talked about the period, and then once we get into the menstrual cycle, we can divide the cycle into 2 parts if we want to. We can talk about the pre-ovulatory phase and the post-ovulatory phase. So once your bleeding has stopped, in order for your cycle to actually fall within that 24 to 35 day range, ovulation would have to take place somewhere between days 10 and 23. So as we go into that pre-ovulatory phase in a healthy cycle, you may see a few what we call dry days, like a few days before you start to observe cervical fluid. Cervical fluid can be like a creamy white hand lotion. It can be like raw, stretchy egg whites. And so when you're moving into that pre-ovulatory phase, we would expect to see cervical fluid anywhere from 2 to 7 days leading up to ovulation. So if you're not like actively tracking and if you're not on hormones, you might just notice that it feels wetter. You might notice when you go to the bathroom, you're wiping and it's really slippery. You have to wipe multiple times. You feel kind of wet. You might notice it on your underwear. But we would expect to see, 2 to 7 days of that with at least 1 day where it's clear and stretchy, like the raw egg white example. And then we would expect you to ovulate. So in order for the cycle to be healthy, ovulation does have to take place. And then once you've ovulated, we would expect that cervical fluid to actually dry up and stop, whether it's all together or mostly shift to very little. And then the second half of the cycle, the post-ovulatory phase in a healthy cycle, is about 12 to 14 days. That's a sign of strong progesterone production, right? And so if you're falling into so just knowing that information is really helpful. It's so frustrating, right? Because when someone lays it out to you like that, lays it out for you like that, you realize it's not really that complicated. And so then you're like, but no one ever, like, why are we not?
Why are we finding this out now?
Exactly. Yes. But I think that's the start, because if we identify what normal is and then we know where we fall into that, then that's when we can start making a difference. And so going back to that vital sign piece for a moment, if your cycle is always 50 days or 45 days, I mean, yeah, sure, there's plenty of women that have long cycles, but that is indicating a delayed ovulation. So what's going on there? Why is it delayed? That could be a sign of, insulin resistant PCOS. It could be a sign of another issue that's causing inflammation that's interfering with that natural process of ovulation. Like, we want to know. It could be a situation of under eating or over exercise or whatever, right? So knowing what a healthy period volume is, some women barely bleed at all. Is it
Right.
even a period? Are we confirming ovulation, right? So there's a lot we can learn just by understanding and tracking the cycle.
And knowing that all of this needs to be figured out sooner rather than later, I would say. So for those people that are listening that are currently on their fertility journey and are frustrated because they're in it and it's not working, it's not happening, versus somebody who maybe has been on birth control for a long time and are debating, okay, when should I get off this? Because I think I do want to get pregnant at some point. When would you suggest for those people that are currently still on birth control to get off birth control, hoping to get pregnant?
Yeah, I mean, this is a big topic. I talk about this a lot. I feel like the main message I want to share about birth control is just that raising awareness of the temporary period of subfertility that occurs post birth control. So I feel like what women are not taught is that it does take your body a bit of time. And I think we intuitively know this to some degree. I've spoken to so many women who, let's say they've been on the pill for a long time, whether that's 5 years, 10 years, 15 years, whatever. And now maybe their partner and them have decided that they want to start trying maybe later in the year. And I've spoken to so many women who, like, they'll make an appointment with their doctor. They'll go to the appointment. They'll say, okay, my partner and I were planning to start to try in the fall. Do you think I should go off the pill? And then the doctor says, no, you'll be fine. If you go off the pill, you get pregnant right away. So you may as well wait until you're ready to go. And then she goes home. And what I always say is, like, wait a minute, your intuition was so strong that you took a shower, got in your car, went all the way to the doctor's office. And even the fact that you're asking your doctor's permission to come off the pill, that's a whole other conversation. Like, what? If you want to come off of it, you can just stop, right? But that's a whole other conversation. So I do think we have this intuition about it, because when you're on the pill, I think what's important to know, the combined oral contraceptive pill in particular, its main mode of action is to suppress ovulation. So if you are still, probably not your audience, but if you're still under the impression that the pill is making your body think it's pregnant or whatever, that's not what it's doing. It's suppressing ovulation. And so if you're on the pill for 10 years, your ovaries have been dormant for 10 years. And when I was just in a class with my practitioners and this topic came up, and when you look at the research studies of the ovarian reserve parameters, so like the AMH levels, antral follicle count, ovarian volume of women who are currently on hormonal contraceptives, their parameters are very low. And studies have shown that it takes anywhere from 6 to 12 months before those parameters fully normalize. So I'm not saying this to scare anybody. We know that women can come off the pill and get pregnant. It happens. But
and I think
when we look at
onto, right, is they know Susie
yeah.
Q that got off and got pregnant right away. And
yeah.
you can always find social evidence either way, but knowing what physically is happening to your body and what you've suppressed it doing, and from an energetic perspective, I feel like, there's a lot of things at play.
Well, and I mean, I know women who've gotten pregnant while they were still on the pill. So, right. but what's helpful is to look at the research, because the only way for us to be informed and to make those informed choices is to really look at, well, what's actually happening? What is the data showing?
Right.
So there's several research studies that look at this kind of ovarian reserve parameter situation. But there was one study where they were looking at fertility preservation. And so fertility preservation is, when you are having your eggs extracted to freeze them for the future, right? So what they were finding was that women would be coming off the pill and they would immediately go to get this procedure done, and they wouldn't be getting a good, when they're doing the extraction, they wouldn't be getting good numbers. So in this particular study, they had these women come off the pill and wait for 6 months before they had the procedure. And so they kind of tested their ovarian reserve parameters at various times. And they found that when the women waited 6 months, they had better extraction. Their ovarian reserve parameters rebounded a bit. Their AMH levels were higher. Again, ovaries were dormant for however long they were on the pill, right? So the ovarian reserve parameters rebounded, AMH levels rebounded, and when they actually did the procedure, they extracted significantly more eggs. So in this study, the researchers concluded that if women are going to have fertility preservation done, that it would make a lot of sense for them to then take a little bit of a break before they came off, and they recommended like about 6 months or more. So obviously the question is, well, then why is this recommendation not made? There is no connection made. Again, in order to find research like this, I'm always thinking, okay, well, in order to find the research, where's the money, right? The money is in the IVF. That's why we can find so much research about egg quality and different things related to IVF. But that's not being carried over. There's no recommendation made for women who are trying to conceive naturally. So one other study I just want to share and just kind of talk a little bit about the research. So generally speaking, the research about birth control and pregnancy, they will say over and over and over again. If you read enough research studies, you're just like, are they told they have to say this exact line? They will say that hormonal contraceptives are a reversible contraceptive method and that there's no lasting effects on fertility. So, and I'm not saying that that's entirely untrue. I'm saying that there's more to the story. When you look at the research papers, most of the papers will take women coming off the pill and will present to you a 12-month pregnancy rate. So they will say that there's whatever it is, 75% of, 84% of participants who came off the pill were pregnant in 12 months. Most of the studies just do that. Now, if you look at the study, they're excluding anybody who was put on the pill for any problem. So if you were put on the pill because your periods were irregular or because you had extreme menstrual pain or because you had any type of problem, you are not included in the study. Obviously, that means that and think about how many women are put on the pill for these problems, right? But so this is a problem, right? But then the other thing is that they're not looking at the month to month. They're not saying how many women got pregnant in month 1 off the pill, month 2, month 3, right? They're saying at the end of 12 months, X percentage. So there was one study that I found that I've shared many times, I shared in the Fifth Vital Sign, where they actually had it broken down by month to month after they came off birth control. And what they found was that the women who came off the pill, compared to women who were just using condoms, it took them an average of 8 months to conceive versus 4. So that's an average. Obviously, everybody didn't take exactly 8 months. Some of them would have conceived earlier. Some of them might have not conceived until month 9 or 10 or 11. But on average, it took twice as long. And the women coming off the shot, it was 18 months.
And I often hear, too, from people, well, I wasn't on a hormonal birth control pill. I was on an IUD or something else, as though that's, the lesser of the evils. So what's your opinion on that?
Well, Sue, a lot of IUDs that women are on are hormonal. Let me answer your question, but I just want to quickly address the hormonal IUD thing, because I think this must be the thing that is in the medical textbooks, because they all say the same thing. They all say it's a localized hormone, it's a low dose. And localized what? If I put lotion on my skin, we know that it goes throughout my circulatory system. So you're telling me that you're going to put a hormone releasing device in your uterus that is releasing enough hormone to prevent you from conceiving, but the hormone is going to stay in your uterus. So, that, and it's not it's no one's fault. Honestly, this must be what they teach them to say, because you've heard this before.
I'm laughing, trying not to laugh because it's so ridiculous, but
literally, anyways, it was enough to prevent you from getting pregnant. So I would say in that particular study, they did identify that women who had the IUD removed, it took them about the similar kind of 8 months to conceive versus 4 months. And I remember they didn't fully specify if it was hormonal or not, but I'm thinking it was hormonal. So, with the copper IUD, it's not hormonal. Now, it's for women for whom it works for, obviously. There's women who absolutely love it. There's challenges with the copper IUD because it works, at least in part, by exerting a bit of a localized inflammatory response. That's one of the reasons why pregnancy doesn't happen. And the copper, it releases copper ions. So there's some degree of spermicidal activity there from the copper ions. But some women experience symptoms with the copper IUD that are similar to hormonal issues, lowering progesterone levels and that kind of thing. So That's a whole other topic. And the reason why they encourage women to use the hormonal IUD is because some of the side effects of the copper IUD include increased pain with menstruation, increased cramping, increased inflammation, and increased bleeding.
I think for me too, the bottom line on any type of birth control is you're disrupting the system. You're basically telling your body and giving it a signal, do not do what you're meant to do. I'm not wanting you to function the way that you're supposed to function. And then they expect it to function perfectly once they decide to get off. So there's so many ways you can do it, but I am so happy that you are sharing these evidence-based studies, because I think it's important too for people to understand these blanket statements that whether it's the pharmaceutical companies or the studies are showed that most of the studies are paid by the pharmaceutical companies. That's a whole nother topic, but they're not giving you the full story, as Lisa mentioned. So take a look at that and see what you feel is the right fit for you.
So all I want to say is that, the bottom line takeaway that I would hope that you have from this is that what we can say from the evidence is that there is this temporary period of subfertility. So there's the research studies that I shared that show a bit of a delay to conception on average. There are the research studies showing the suppressed ovarian reserve parameters. There's also research studies that just look at menstrual parameters that we didn't really talk about that show that it takes time just for the cycle to normalize. So I just shared with you all the different parts of the cycle, the average length. So, it takes anywhere from 9 to 12 cycles off birth control before all of those parameters are fully normalized. So the message is, if you're wanting to conceive, then it would make a lot of sense for you to come off the pill. Now, in terms of how long, now I would say that if you had any cycle issues, if you were not going to be included in that study because you had irregular cycles or you had some problems or you were put on because you had really painful periods, 18 months to 2 years. Now, I know I say that and some people are like, what? But I would say if you had problems coming off that early when you still are trying to avoid, so that means you're going to have to come up with a non-hormonal barrier method or something, or fertility awareness combined or whatever. But I mean, you're grown up. You can, I trust, I know it's scary, but it's a thing you can do. I just have to say that because a lot of women really get so nervous about this, but you can figure this out, right? But that would be the suggestion. So you're still avoiding pregnancy, but you're coming off the pill to give your cycle a chance to normalize. You're learning a little bit about your body. If there's a problem, you can identify that problem,
right,
and you have a runway of time to sort this out. You have time to make appointments with people. You have time to get coaching. You have time to sort it out. You have time to chart your cycle. I have worked with women who have come off the pill immediately, like the doctor suggested in my other example, right? You don't need to come off early. Who when your heart shifts, it shifts immediately. Your body might take 6 to 12 months, but your heart shifts immediately. So, and we have been taught from junior high that you could get pregnant every day. So these women are coming off assuming that they're going to be pregnant immediately. The amount of emotional turmoil that it causes women who don't have this information and they're actively trying now, and this is their window. They've been waiting their whole lives for all the pieces to be in place, and now it's in place. That 1 month, 2 month, 3 month, 4 month delay, by month 6, they're already in the office, asking about IUI. This is really, really serious. So
yes.
I think that it's important to just that's my message. Just really think through the timing. And if you're thinking about getting pregnant next year, or within 2 years, it's time to start thinking about getting off the pill.
And err on the side of more time than less time, because in fertility, we know that time matters. So you want to give yourself additional buffer in case the plan doesn't work out the way that you thought it would. Because I can tell you from my own experience at 41, 42, 43, trying to have children, it's stressful when you're like, oh my gosh, I don't have time. It's whatever. So,
and you can't speed up that transition. I would say, obviously there's a ton of things you can do to support your nutrition and obviously, right? But your body still that study that I said with the AMH, it's not just because you eat really, really good that the AMH is going to be higher sooner.
Right.
It takes time.
There's
right?
So many things to play. Yes. Okay. So tell everybody how they can work with you, follow you, learn about you, all the things, because there is so much more here, you guys, of what I would love to dig into. And I know we keep these short for a reason so that you guys can all get quick snippets, but tell us more, Lisa. Where can we find out more?
Well, thank you so much. Everything that we talked about today, we talk about extensively in our book. So Lily and I wrote Real Food for Fertility specifically for women who are planning to conceive in the future, but I would also add women who just want to have their cycles healthy, like women who are concerned with hormonal imbalances and all kinds of cycle issues, because we lay the foundation in that book just to have healthy cycles, and the byproduct of healthy cycles is better fertility, right? So I would say, if this interested you, head over to realfoodforfertility.com, grab the first chapter for free. If this conversation is interesting to you, I have been podcasting for the last 11 years. We are almost at 600 episodes. It is wild.
You only like you're 15, Lisa. How is that possible?
I know. Whatever you think, probably add 10 and you'll get closer to the age. Definitely not 25. 42 at this point, 3 kids. The eldest is about to turn 13, which is wild as well. But yeah, so Fertility Friday is my podcast. There's now another company that decided to name their podcast Fertility Friday. So I am the pink one. You will find me. I'm on Instagram at Fertility Friday, and you can learn more about my programs at fertilityfriday.com.
Amazing. Well, thank you so much for being here, and I can't wait to dig more into it. Again, I've been pushing your 5th vital sign for many years now, in the best way possible. And I can't wait for everybody to just hear your voice, put a name to a voice, and find out more about all the amazing things that you're doing. So thank you so much. Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your friends with fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.